Welcome to Rick's Corner. I have a special guest today and hopefully a future co-host, Dr. Tara Grace Perry, who's an acupuncturist, among other things in life. And she's going to inform us what acupuncture actually does, because she tortured me yesterday and made me a new man. And then I went to the gym today and killed myself with a leg press collapsing on my knee. All the work that you did, I just undid.
I worked so hard to get your body up and running, and
it did.
What'd you go do? What'd you do in the gym today?
I think I put the wrong gas in it, probably. I don't know. I've never done this in my life. You know, you have the stops.
Wait. You say you haven't done that injury before, but we've all seen your website. You've got arrows pointing everywhere for injuries. So when are you going to stop the injuries?
No, this is a new one I'm going to put on there.
Yeah, I know, but...
Well, they have stops in the leg press, and you close them, you let it set. So I was doing calves, and I forgot to close the stop, and the sucker came right down and shoved my knee right to my chest, and there I was stuck, and my shoe was over there. And
now, I texted you earlier, and I'm not sure the answer, but are you accident prone?
Why would you say that?
Because of that poster you have with all the arrows everywhere.
No. You have to look at my profession. Wrestling was one thing, and you have a ton of injuries in wrestling. Bodybuilding and weightlifting is another. You have a ton of injuries in those sports. It's no different than football, baseball, all of them. It just happens to be that I'm always there when an injury occurs. So maybe my kids think I'm accident prone because I usually have bad accidents on holidays.
On holidays, is there a psychological?
I don't know. Fourth of July, I blew my arm up in a
subconscious reason for this.
I don't know, but on the 4th of July, when I was about 16, I blew my arm up in a barbecue pit and it exploded. Halloween, I cut my fingers off.
Now you still haven't told me why you did that.
No, we don't talk about that.
Are we gonna maybe
get
that out of him?
We can't alert the public. And then on Thanksgiving, I tore my quad. So, see, when's the next holidays? One's coming up, I think. I gotta be careful. I gotta be bubble wrapped. Because things happen. I hope that all my body parts stay together, because I have a jar in there with most of them.
Oh gosh.
My fingers in there. And
this is starting to sound like a bad sitcom.
Okay. All right. Let's talk about something pleasant. Let's talk about acupuncture, because people think you're just being stuck with needles randomly, and you're not.
Well, believe it or not, when I was in acupuncture school, one of my first patients had lupus, and I thought to myself, how on earth am I supposed to help somebody with lupus with a handful of needles and a handful of herbs? And we, of course, applied the things that we had learned throughout the program, and lo and behold, she got better. And now I've got people from major hospitals referring me to patients with things like lupus and other difficult diseases.
So it works with diseases as well as injury?
Yes. The thing about orthopedics and injury is that it increases blood flow and neurological activity to the area, so your body can heal quicker. I mean, your body's doing a cascade of things every day. When you injured that knee, it's this whole orchestra of activity goes on inside your body with the body signaling and nerve impulses, and it knows exactly what to do and in what sequence to heal your knee.
Yeah.
And it's only when it's overwhelmed, which you do regularly, that your body, you experience pain and you have an injury that lasts. So acupuncture is a way to stimulate the body to do what it does best and heal itself.
Well, there's a bunch of little guys running around with chisels and hammers right now putting me back together. So, like when you say it does have things going on, you can almost feel it starting to repair itself.
Yeah. So acupuncture is increasing that. 25% of racehorses get acupuncture, and that's because they know that the injuries are going to heal quicker, they're going to run faster, they're going to perform better. Athletes are getting it a lot more. There was the cover of Acupuncture Today last season when the Giants, they reported that the acupuncturist was working a lot with Randy Johnson, who was, he pitched until he was, 47 years old, which is almost unheard of in baseball.
So it does work. Now, you stuck me in different points from my feet, all over my body, to my head, to my neck, and what do those points actually do? Well,
the body in Chinese medicine is seen as a series of almost like rivers. We call them meridians. And I can actually, when I was in acupuncture school, I was in this terrible exercise class and threw my back out. That was the first time I'd ever thrown my back out. I was a starving student. I didn't have insurance, but I had been in class and I knew how to fix low back pain. So I took a handful of needles and I started sticking them behind my knees and in my hands, areas that have a strong impact on the low back. Even the top of the head, you're bringing the energy clear up the spine, which goes right through the low back and helps the low back. So I used about 6 needles, and thank gosh, in an hour I felt about 50% better, because I was walking around like I was 95 years old. I felt like I was really in trouble.
Joints, for example. All right, you told me that if my knee is bone against bone, there's only so much you can do.
Well, it's always worth a try, because when you're in a critical situation like that, I mean, unless it's something that's like, I mean, obviously if you're in a terrible car accident, you need to go to the orthopedic surgeon and get put back together again. But if there's a chance that you can recover and not need surgery, I mean, would you rather go through 10 acupuncture sessions? And how did you feel after the acupuncture session?
You know that I thought about that after I left. It was very, very relaxing. I felt soothing, and then I went to the gym, and everything felt kind of like I was just okay.
Most people leave my office more relaxed than if they'd gotten a full body massage.
Yeah.
And that effect lasts so much longer than a massage. So if you can get that as medical treatment for, say, 10 sessions to see whether or not you can solve an issue that you're being told you have to have surgery for, isn't that worth it?
Absolutely.
I say people surgery all the time.
Yeah.
You know, people come in with a knee that's all swollen up because they were, in a weird position for work or something, because I get, camera guys that come in and they're told they need to have surgery. Well, they get it aspirated and they come in regularly, like twice a week for 3 weeks, and a lot of times they don't need it.
Tendons and ligaments. I know one or the other doesn't get blood flow.
They both don't have a great blood flow because you see, like when you take a piece of chicken and pull it apart, there's no blood in there.
It's all white.
Yeah. So in the best of cases, if you just let nature do its course, it takes about 8 weeks for a tendon to heal. So acupuncture is going to speed up that process.
Yeah. When I tore my quads in 2001, it took me 6 to 8 weeks for them to heal back. It was a process, and it was a long process.
Some of the most outstanding things that I've seen, which really signal to me that acupuncture is getting energy to move into areas like Bell's palsy, facial paralysis. It's known that in Western medicine, if it doesn't heal in 6 months, it's not going to heal. I've had people a year later, 3 years later, even 30 years later, a severe case. And that particular case, he didn't make a full recovery, but he's able to smile more than he ever has in his entire life.
What causes that?
They think it's a virus, which is why they give you steroids to treat it early on. But again, by stimulating the neck areas and the areas around the facial nerve, it's astounding how many cases have gotten full recovery even years later.
And you've been doing this how long?
16 years.
And you're 19 now.
I'm 19. No, I studied at one of the top 5 traditional Chinese medical hospitals in China, Chengdu, that area that had the terrible earthquake. That's where I was. And I taught at UCLA. I did the acupuncture on David Duchovny for the cover of Esquire magazine.
I saw that.
I was with Florence Henderson on Lifetime Television.
I saw that.
That's a clip on my website.
That's cool.
AcupunctureBeverlyHills.com.
I'm going to put that up on the site as well. But I have a lot of people that watch this. They're professional wrestlers and they're bodybuilders and they're weightlifters and they're athletes. And wrestling, for example, really, really is hard on the joints.
Absolutely.
Hard on the joints. Mostly the neck and the shoulders and the knees. And then mostly the left side of the body.
Honestly, when I think wrestlers discover acupuncture, if you did go tweak yourself today and you started giving it regularly, you'd see the improvement.
I know. And it is on the left side of the body on wrestlers. Do you know why?
Why?
I'm going to tell you. When you're in professionally wrestling, if you ever watch it, and you keep your eye on what I'm saying, you always use the left arm and you always use the left leg. It's a universal thing. When you work with somebody, always grab to the left because they know where to go. So over years of wrestling, I wrestled since 1965, this left arm took a real good beating, being twisted, wrenched, pulled down, and the joint gets beat up, and the leg as well. So that's why wrestlers mostly on their left side have injury, because it's always the left side of the body used. Now, in weightlifting, in the past 5 years, I've seen a lot of quads being torn, a lot of them. That's due to a lot of heavy weight, it's due to a lot of heavy steroids, and it's due to a lot of heavy growth hormone, because your tendons and your ligaments can't keep up with the muscle, and they get weak and they snap. So you guys that watch this need to see her, or somebody like her, especially if you're in the area, her for sure.
Well, you need to see somebody that really knows what they're doing and has a knack for orthopedics, because there's acupuncturists practice different ways.
Yeah.
Some of them excel in this kind of thing, and some of them excel in that kind of thing. I happen to have. I'm part of the National Acupuncture Orthopedics Board, and that's a multi-100-hour course. And there's lots of us across the country, but we have an extended training in orthopedics.
Well, that's what I meant. I mean, that's what you have to do. I mean, surgery is the last resort. I need a knee replacement. I was told that in 2001. I've been skating around it, getting cortisone shots, using ice, doing everything I can to avoid it. And now I can see the knee is starting to bow out a little bit to the side, and I walk, it's starting to curve on me, and I'm going to have to do something.
I'm not against surgery. There's a time and a place for it. I just know that there's a lot of people. I've had people come in that have had atrophy of a muscle because of impingement here in the neck.
Mm-hmm.
I've been able to reverse that. I've had people come in with what's called drop foot,
Mm-hmm.
which means you can't properly lift the foot because of impingement in the low back. I've reversed that many times. In fact, much more often than not. I actually don't know if I've had a case of that hasn't reversed. I probably have, but much more often than not, I'm able to get nerve activity going down the leg and fully functioning.
That's interesting because I had told you my left shoulder's frozen. I mean, I have a lot of calcium and the range of motion's bad. I noticed that my arm the muscle has atrophied somewhat because of lack of the use of the shoulder. Even though I work it hard,
Mm-hmm.
it still doesn't feed like it wants to.
Yep.
It's not getting the blood.
Mm-hmm.
Is that what it is?
Well, I think I told you I had a motorcyclist the other day who came in. He couldn't lift his arm any higher than
Yeah.
that for 10 years because of the accident he had. I saw him 4 times, and he's now got full range of motion and no pain. Frozen shoulder is a tricky thing because there's obviously little particles. You see the X-rays that the orthopedic surgeons
sure.
take, and there can be a particle in there, and boy, that hurts when there's a tendon on a.
It does.
So sometimes arthroscopic work is good. They go in there and they actually clean it up. But again, if you're able to fix it with just several acupuncture treatments, and I don't mean go 100 times, but I would suggest doing 10 close together, like twice a week for 5 weeks.
Yeah.
And that, that's a very good college try to see if you can get the ball rolling in the right direction.
Well, I'd much rather do that than first of all, the surgery in the shoulder is a long recovery time.
Mm-hmm.
You're like this for months, then you're like this for months, then you have to go like this for months, and it's like, I want to get back in the gym.
Well, the interesting thing about surgery also is sometimes people go in for surgery and the problem doesn't get corrected, and now you've got all the damage done by the surgery.
Exactly.
So that's,
They have a substance, my doctor told me that you shoot in your knee, and it's a gel. And I forgot the name of it, but it's supposed to alleviate the pressure and let your knee heal if you need a knee replacement or if you have arthritis, and what I do, and the cartilage is gone. But the problem that she told me was it only works on 50% of the people. Because if you have debris floating around, which I do, that stuff can float around and lock in underneath the kneecap or in the joint, and then you really got a problem.